My mum had 4 of us all at home. She just used to say having a baby was the best day of your life. I think knowing that and always growing up with that, I didn't see home birth as something that was sort of way out there. To be able to be in my own environment, and it was just, my children were just upstairs, and it was more like a family event. It was just brilliant. I'd love to do it again.
What would you say to someone who was thinking about having a home birth?
First of all, I think my first response would be brilliant, and then I'd give them all the information, obviously tell them about your support group and online support groups. I'd also say to them about, women when they're unsure about what to do. I always say to women, if you're unsure and sometimes you don't know how you're going to feel till you actually go into labour, I would say set up for a home birth, because you can just have one contraction and change your mind and come into hospital. But we can't do it the other way, and that's because we need to do a risk assessment before you've had a home birth. We need to get you the equipment at your house. We need you to be on the on-call register. So it's much better if you're thinking about it, set up for one. You don't have to do it, but then it gives you that choice when you go into labour, and then you can choose to stay at home. As a midwife, being at a home birth is fantastic. For us, we can just concentrate on just being with that one woman. Quite often there's 2 midwives at a delivery as well. So, women are getting really, good care. We're giving them our undivided attention. So as long as they're making good tea and keeping us in tea and biscuits, we're usually all right with that. So there's no distractions for us, there's no phone ringing, phone calls that you get sometimes when you're working on the wards, or people knocking, looking for you, asking for keys for drugs, that kind of thing. So we can just give our full undivided attention. Everyone thinks there's loads of mess when you're having a birth. And yeah, there is a bit of mess. But part of our job, we have to take away and clear all that up. I've delivered babies where I've walked in and there's cream carpet, cream walls, cream everything, cream settee, and we've left without any mess whatsoever. So I think that's something that usually the dads worry about, is the mess, but we sort of clear all that up and sort it all out. And if you have your baby in the pool, then you sort of all the messy stuff's a bit more confined. No midwife wants to be in a situation at a home birth where things are going wrong. We have a criteria that we book women for home births that are usually low risk. So we've done a big risk assessment before they've even gone into labour. Once that happens, and say labour isn't progressing normally, any deviation from the norm, and we'd probably be looking at transferring that person in. It's not a situation where we'll say, well, let's just wait and see how it goes, We don't take risks with babies or mums, we transfer in. But luckily that tends to not happen too much at home deliveries, because women tend to just labour better at home anyway, because they're in their own environment.
What would happen if the baby wasn't breathing when it was born?
I know that's a question that most women worry about, but all midwives are trained in neonatal resource, and we have to do that update training yearly. It doesn't happen, I have to say, very often, but midwives, we also bring our oxygen for babies and suction, and the best thing that you need for neonatal resource is actually a towel just to rub baby to get it going. So that if that was to happen, then we could do the neonatal resource at home. But again, it's not a common situation at a home birth, but we have got that covered. We listen to babies every 15 minutes during the first stage of labour, and more frequently in the second stage of labour. And we just use those little Sonicae, the little Dopplers that we use when ladies come to the antenatal clinic. And what we do is we listen after a lady's had a contraction, because if baby is showing signs of distress, they usually do it after the contraction is finished. So again, it's the same that you would get if you came to the birth centre here. We do exactly the same on their own low-risk birth centre. If ladies need to be continuously monitored, obviously that's a reason maybe to be at the hospital. We bring Entonox, which is the gas and air that women like. We bring that to the home deliveries. You tend to find that because women are more relaxed, they tend to labour a lot quicker at home. They tend to, because they're in their own environment, they again, being relaxed, tension causes pain. So when anybody can relax in labour, it also reduces the need for analgesia. So we can use Entonox, other things, alternative methods. The pool is amazing, and I know we've got this new pool that women can have now that's been set up. We've also using massage, paracetamol, again, is always good, but actually one of the best things for women is actually giving them a lot of support, both from the midwife and from their partners. You know, reassurance is a big key to managing people's pain relief. I've had 2 home births. I think what inspired me to have a home birth was probably my mum. My mum had 4 of us all at home. She just used to say having a baby was the best day of your life, and it doesn't hurt, is what she told me. And I think knowing that and always growing up with that, I didn't see home birth as something that was sort of way out there. My son, my oldest son, is 16 now, so obviously it was a little, before I was a midwife, I've been a midwife 10 years. I had 2 of my children before I was a midwife, so I didn't know any of the complicated stuff. So for me, it was just a normal, natural thing. And then actually I've had one since I've been a midwife, and again, it was just amazing to be able to be in my own environment, and it was just, you know, my children were just upstairs, you know, and it was more like a family event. It was just brilliant. I'd love to do it again, but I can't. I think a lot of men worry, and my husband was the same when I was thinking about having a home birth, about the responsibility being on him. And it's about reassuring them that actually, no, it's not. And actually for men, it's actually better for them to be in their own environment too. You know, they can wander around the house, they can use their own toilet, they're not having to ask permission to be anywhere. So I would definitely encourage them to come and talk to a midwife, because as soon as you mention home birth, then somebody will always have some kind of negative thing to say about it, just purely because they don't understand. So you need information off the right person. I think for the benefits for women being at their own home birth is they're in their own environment. Women need to feel safe to give birth, and being at home with all the smells of home, you know, I think people forget that actually at the end of the day we are mammals giving birth, and you know, being in your own environment makes women can feel safe. So they tend to labour quicker, they tend to need less pain relief. There's obviously less intervention at home, and they just seem to get on with it. My last home birth, the first time one was like only 3 hours or something like that from start to finish. You know, and it was just, she just laboured, she had total confidence in her body to do it, and I think that's the key. It's women that tend to labour at home and choose to have home births have confidence in their bodies to do it, and so the body just gets on with it.